Thursday morning in Houston, Texas, and I'm at Dr. Darren Mitchell's office, and he has a very interesting case that he's going to share with us today. Dr. Mitchell, welcome to the program, and tell us about the case. Tell us about your shingles case.
How you doing? My name's Dr. Mitchell. I'm a chiropractor. Mike and I have known each other for probably 12, 13, 14 years now.
One of the first doctors in Houston, in America actually, to get the laser.
Exactly. I've been a patient of the MicroLight for a while and just had tremendous results with it. Recently, this is a patient of mine named Carlos. He's been afflicted with a horrible case of shingles, and it got diagnosed about 3 or 4 years ago. He was told by his doctors it's one of the worst cases they've ever seen. He had these, as you can see, he's had some scars left from the vesicles where the virus attacked his nerve, primarily the S1 nerve. And he really kind of got to me out of luck because his daughter and his son-in-law are patients of mine, and they just one day asked me, said, "Hey, look, you got anything that might work for nerve pain?" They weren't even really specific on what's going on, saying my dad got this, something going on. And honestly, I gave him another topical cream that I wanted to try first, but I said, "Hey, look, I need to see him." And so when he came back, and I got to examine him, I was like, "Oh, I know what this is. This is post-herpetic neuralgia. This is the shingles virus."
Right.
And I said, "I have a device that I've had some success with called MicroLight, laser, and I'd like to see what we can do with it." So we've basically been able to identify places in his body along an S1 nerve route through the piriformis, down the hamstrings, into the calf, and all these different scars and trigger points that we've had. And through the laser, we've been able to take his foot that was in a constant state of hyper extension, almost like a forced hammer toe, to where he couldn't step off and he couldn't even straighten his toes out, and he was having to walk right on his metatarsals. And so with several sessions here now, we've gotten to where his toes have been able to extend and step out. The pain has significantly gone down in his foot. The temperature's gotten better too, hasn't it, Carlos?
Yes.
His foot was always cold. I mean, ice cold, and now he's getting blood flow back into it, and so we've had a lot of fun taking this chronic 3-year-old case and improving his function. Now he's not 100%, but he's definitely at a much better place than he was 3 years ago. And so we're hoping to continue to get as much back of function in this leg as we can, better pain control. But it's always been fun as we work on it. We can see the muscles fasciculate. We can see areas where there's hyperintensity within the muscle. We know where we kind of do the combination of not just holding the laser, but kind of stripping out in a like a myofascial type of position where we're getting the radiation from the laser to release and find, and you can actually use the device to find, because it's the way it's designed, you can feel it through almost like an instrument, soft tissue technique, where you can go, "Oh, look, here's a spot here." And then with the irradiation, you'll also see, based upon how the foot moves and jumps and relaxes and where all that stuff is, of areas that you need to focus on.
So Dr. Mitchell, if a patient or a doctor or a fellow clinician is watching this video in the weeks and months to come, how many treatments did it take for Carlos to start to feel some relief, or for you personally, clinically, to think that you were doing something good?
I knew the first day we got on the laser we were doing something. We saw the reactivity of the muscles, and I knew we were in the right area. And then, the fact that I knew it was working better, Carlos was anxious to get on the books as much as he could because he was looking for relief. And so shingles is an interesting, condition. Medicine, if you can catch it early and you can maybe get them on the antiviral medication and on the steroid pack, sometimes you can jump in there. But I've had success with cases where if I get it initially, I get after them on the laser, and those cases don't tend to be chronic. Now, I've had a couple of cases where they've been chronic and that I haven't been able to get to them in the first half, that you got to come back. And it's much, much harder. So I would say that any doctor out there that can identify the shingles early on, and not let it be full blown where they have the vesicles and they have the lesions, just call it that. They'll give you that causalgia pain, they'll give you that nerve pain, they'll tell you the sheet hurts, if they tell you they can't sleep, it's the worst pain they've ever had.
Okay.
Treat it.
Doctor, any contraindications?
Not that I've seen.
You've been comfortable from day one.
I've had about probably 5 or 10 cases now over the years. It's not something that comes in every day, all day, but like I said, these people really, really suffer, and when medicine doesn't give it to them, you come back, you support the immune system because they have a viral infection, you use the laser, you do some other techniques to help, boost the body's ability to, help itself, and that's what we're basically doing with the laser, and it's been I would say the gold standard treatment for shingles.
Well, Dr. Mitchell, thank you so much for your time today. And how do folks get a hold of you? Where can they find you?
My website is Natural Health Houston. I'm at 2022 West Alabama here in Houston. And my phone number is 713-522-9814.
Well, Dr. Mitchell, thank you so much for your time this afternoon, and good luck with this patient.
Thank you.